Teen suicide is on the rise, making it the second leading cause of death in America. And last month, we told you here that in California and across the nation, there is an alarming shortage of mental health care for kids.
Yeah, only 16 of our 58 counties in California have psychiatric hospital beds for children. Kristine Lazar continues our Kids in Crisis series, exploring what resources we do have.
It's almost like, you're reaching out to somebody and you're gaining a new friend for a little bit.
These teens are here to listen.
There's just a bond there that's kind of immediate when I pick up the phone that just says, I'm on your team and I'm at your level and I'm here to help.
Charlie Kapanos and Luna McNeff-Yee are local high school seniors who volunteer for Dee Dee Hirsch's Teen Line.
Teens tend to call about, relationships and school stress and family stress and, really they can call about anything. And, sometimes we will talk to callers who are having suicidal thoughts, or we'll talk to callers who are experiencing child abuse or relationship abuse.
Teen Line is open every night from 6 to 10. Volunteers complete 65 hours of training and another nearly 100 hours of observation before they ever take a call.
So I put them up against some of the best. I'm a licensed marriage and family therapist. I put them up against some of the best of us because they also know what it's like to be a teen.
Teen Line has been around since 1980, but lately the severity of the calls they receive is on the rise.
I'd say a lot of my calls have been about suicidal thoughts, yeah.
The age of the youngest callers is dropping.
We've really had an increase in the number of teens under 12 reaching out, that now it's about 10% of our contacts, whereas it used to be a couple years ago not that high.
And yet, the availability of mental health services for children has not kept pace with the need.
We talk to people from all over the city, all over the country. In our emails, we talk to people from all over the world. And because of that, we often recognize when we're trying to connect people with resources that are accessible to them, often there isn't much.
Children's Hospital Los Angeles is trying to change that.
I've definitely faced with my own patients through the years, even pre-pandemic, really not being able to get them into therapy in a timely manner.
That's why CHLA applied for and was awarded a $2.5 million grant to train up to 190 pediatric residents to address the growing mental health crisis facing our local kids.
Really, we get complaints of anxiety, depression, even suicidal ideation daily. And if a child comes in for a well child check, a teenager comes in for vaccines, and then we do screen routinely, it's often revealed that there's something really serious going on.
And I imagine, too, the idea is if you can get to these kids early in their crisis, you prevent them from ever needing to be in the ER.
Absolutely. That's a goal, is that you're addressing it as soon as it's coming up. You're not waiting for referrals out. You're not kind of sending to another place to get addressed.
Kristine Lazar, KCAL News.
Just incredible, the numbers there. The $2.5 million grant, which doesn't sound like a lot to those of us who know how big this issue is, will also fund, though, a psychiatrist at CHLA to be present in clinic to answer medical residents' questions in real time.
Yeah, and this is just such a huge issue, and it's really illuminating to hear from the teens themselves and to know that they're working with each other. And it was a great point that they understand what it's like to be a teenager right now. We don't understand that as adults. It's a totally different world.
No, we didn't have phones in our bedrooms at night with social media on them to just have those bullies come home with us. I mean, there's just so much that has changed that it is.
We didn't go through a pandemic.
No, we didn't.
So,
well,
really
we did, but not as a teenager.
Right,
yeah,
really good
which is very
reporting
different
there. And also, if you go to our website and click Seen on TV, we'll have the phone numbers for that teen line. And we do want to remind you, there is more help available, like the National Suicide and Crisis Lifeline. You can call or text anytime, 988.